Most health professionals consider type 2 diabetes to be a chronic and progressive disease. This promotes the idea that type 2 diabetes is a one-way street. There is no reverse gear or no U-turn. The painful death is sure shot ahead. The disease continually gets worse until you eventually require insulin injections. But this is actually a great big lie, which is excellent news for anyone who has been diagnosed with prediabetes or type 2 diabetes. Recognizing the fallacy of this belief is the crucial first step in reversing the disease. Actually, most people already instinctively recognize this. It's ridiculously easy to prove that type 2 diabetes is almost always reversible. Suppose you have a friend who is diagnosed with type 2 diabetes, meaning the level of glucose in his blood is continuously above normal levels. He works hard to lose 10 kg of his weight, which enables him to stop taking his glucose-lowering medications because the levels in his blood are now normal. What would you say to him? Probably something like, "Great job. You are really taking care of yourself. Keep it up." It seems perfectly obvious that the diabetes reversed because your friend lost all that weight. And that's the point. Type 2 diabetes is a reversible disease. We've intuitively sensed this truth all along. But only diet and lifestyle changes, not medications, will reverse this disease, simply because type 2 diabetes is largely a dietary disease. The most important determinant, of course, is weight loss. Most of the medications used to treat type 2 diabetes do not cause weight loss. Quite the contrary. Insulin, for example, is notorious for causing weight gain. Once patients start on insulin injections for type 2 diabetes, they often sense they are heading down the wrong path. My diabetic patients would often say, "Doctor, you've always said weight loss is the key to reversing diabetes. Yet you prescribed me a drug that made me gain 10 kg. How is that good?" I never had a satisfactory answer to this important question because none existed. The plain truth was that it was not good. The key to treating diabetes properly was weight loss. Logically, because it caused weight gain, insulin was not making things better, it was actually making the disease worse. Since weight loss is the key to reversing type 2 diabetes, medications don't help. We only pretend they do, which is the reason most doctors think type 2 diabetes is chronic and progressive. We've avoided facing an inconvenient truth: drugs won't cure a dietary disease. The problem is not the disease. The problem is the way we treat the disease. The same principles used for reversing type 2 diabetes also apply to preventing it. Obesity and type 2 diabetes are closely related, and generally, increased weight increases the risk of disease. The correlation is not perfect, but, nevertheless, maintaining an ideal weight is a first step to prevention. One can prevent diabetes by keeping his weight ideal for his age and height. This is for all today's health tip. For staying healthy and staying fit, please subscribe to my channel. For consultation, please leave a message at sagarsuryavanshi3001@gmail.com. Thank you.